The First Amendment gives U.S. citizens the freedom and right to practice his or her own religion. However, this does not exempt parents from the duty to protect their children in relationship to their religion. While child neglect laws are different state to state, the overall generalized consensus states that parents are required to provide food, shelter, and necessary medical care to their child. A well-known case, Prince v. Massachusetts, determined that adults are free to willingly medically endanger their health in relationship to their religious beliefs. However, this does not apply when making medical decisions for their children. State v. Norman was quite similar to the Newman case. Both parents believed their child would heal from diabetes from prayer instead of medical treatment, resulting in their children's death. Both cases noted that while religious freedom is a right, and should be respected by healthcare professionals, if it causes harm to the child, it is illegal, unethical, and intervention is required. Intervention is required by the American Academy of Pediatrics. The American Academy of Pediatrics states that all children deserve effective medical treatment that is likely to prevent substantial harm or suffering or death. Thus, it is important that healthcare professionals agree with the ruling of these cases, as it is unethical because the death of these children could have been prevented through medical treatment. Providers were not suggesting that these children be on a life-sustaining assistive device, which would be unethical because providers should not be making suggestions in regard to life-sustaining or end-of-life care treatment. It is important for the parents and the healthcare professional team to discuss these decisions, but a provider is not ethically allowed to make these suggestions or make these decisions for the child. However, these children, like many other children in America, had diabetes, which is a manageable disease with medical treatment. While it is important for the healthcare team to uphold the ethical principles of autonomy and beneficence, thereby respecting one's religion, there are exemptions when a child's life is at risk for harm. Provision 3 of the ANA Code of Ethics for Nursing explicitly states that nurses are required to promote a culture of safety and advocate for their patients. This not only includes mandated reporting of fellow coworkers putting patients at risk, but being a mandated reporter of child neglect. Being a mandated reporter includes that the nurse must let the case management and follow the guidelines that the hospital has provided when needing to report child neglect, as well as including letting the state know of this child neglect so the state can further intervene to help reduce the harm for this child and appropriately assess the situation. In addition, nurses are expected to follow mandated reporting in a timely manner to promote safety of their patients. Because children cannot always advocate for themselves nor dictate medical treatment, nurses play an extremely important role in advocating for this vulnerable population. Therefore, nurses must be able to identify and recognize child neglect, which include parents restricting appropriate medical care to their child.